Can molecular testing of the blood, as opposed to the bone marrow, be used to determine MRD status?
Can we use molecular testing in the peripheral blood instead of the bone marrow for prognosis? That's a great question. We don't have yet the technology to have a guarantee that this will tell us how well a patient will do. A lot of companies and investigators are trying to find that special assay that allows us to be able to detect malignant plasma cells and then use that information for prognosis from the blood. Because as most people know, having a bone marrow test is not fun. But right now, that is the gold standard for measuring prognosis and minimal residual disease. If the technology can be perfected on a blood level so that we can just draw a blood test and measure MRD this way, we'll have a much better way of determining prognosis without putting the patient through a bone marrow test.
So the current tests for MRD testing are bone marrow based, either next generation sequencing or flow cytometry based tests. The next generation sequencing tests are probably 10 times more sensitive, so they can find more cells even if they are hiding compared to the flow cytometry test. It's obvious that it would be much better if there was a blood-based test. Then patients did not have to undergo bone marrow testing. The test could be applied much more often. There have been attempts, we and others have worked on blood-based DNA tests for MRD tracking. The experience so far is that those tests are not as sensitive as the bone marrow tests. There is much less DNA in the blood. It's more than 1,000 times less. So in order to compensate for that, you need very large volumes of blood. So I think it's probably practically not so possible to use those types of tests to rule out minimal residual disease, unfortunately. But there could be other ways. So we and others are also working on protein-based tests. Proteins can be released by cells. So even if there are very few cells, these proteins can still be detectable. We already have assays where we can find more than 1,000 times sensitive compared to all the conventional blood tests that we and others have.